I want to talk to you about some of the exciting things you're going to learn in the advanced clinical training. In that, what we're learning is not just how to relax or solve simple problems, but really to understand deeply how to make changes so that the person's structural issues are resolved, so that the structural issues that are coming from their energetics are also resolved, and just to understand at least very deeply the deeper layers of anatomy. So when it comes to the neck, I'm going to show you how the superficial layers such as trapezius, semispinalis capitis, multifidus, and rotatories are essential for you to address. And even more deeply, the suboccipital muscles. The suboccipital is amazing. Just within these little span of two vertebrae, you have four muscles, all of which orient the head on the neck in dramatic ways, affecting the eyesight, affecting headaches, affecting the sense of balance. This is a key area in the body that you have to learn how to address in detail in order to really help someone in detail. So I'll just show you how to do this in just a sec. Now, there's three main layers to the back of the neck and then the suboccipitals. So the first thing I want to do is draw the trapezius back to the center line, kind of helping the head come back on top of the body. So often it's forward of the rest of the body. Then I want to address the cervical members of the erector spinae, the main one of which is semispinalis capitis. And so I'm coming anterior to the trapezius, little cross vertebra to palpate, and then where I feel the tension, then I can melt in, just working with the trigger points that I find. And we're going to be using what we call fulcrums, which mean we connect not just with the tissue, but also with the nervous system and initiate its letting go. The third layer is multifidus and rotatories that are running across from transverse up to spinous processes. So you palpate that with cross fiber. You can't be sure what's there unless you feel it through the cross fiber, and then at about a 45-degree angle, melt into that when you find tense areas. By the time you've done that, you've resolved a whole lot of the tension in the neck. But let me show you then how to work with those suboccipitals, of which there are four. I'll show you on the other side. There's one that's right here below the mastoid process. There's another that connects between the transverse process of the atlas and the spinous process of C2. Oftentimes, as in the rotatories, you'll find the effects of whiplash in that muscle, obliquus capitis inferior. And then there's two muscles that run up. Rectus capitis posterior major, which I'm palpating with cross fiber and then melting in. And then I like to lift the occiput up and give the person a sense of traction and really a much deeper sense of opening in this critical region that gets locked up when we're driving, when we're using a computer, and so on. And then coming in right next to the spinous processes, rectus capitis posterior minor, cross fiber, melt in, and gently lift up, holding the suboccipital area in openness so that the whole nervous system creates a different set point and a different sense of what's the new normal for this neck that is now going to be much healthier. That's just one of the exciting things that you'll learn in the advanced clinical training program, along with zero balancing, more fascial release techniques, deep tissue, deep massage, clinical body work, zero balancing, shiatsu, psychology of body work. Just come and join us for a free intro that we'll have soon, and give the school a call.